Hello everyone, welcome to another episode of our Wellness Exchange series. Today I'm joined here by Dr. Gogu, and today we're going to be talking about men's health. Doctor, thank you so much for joining us today.
Yeah, thank you for having me, and I thank the Hidalgo Wellness Program for having me here today to talk about an important subject.
Thank you so much. So let's go ahead and talk about men's health. What are some of the top health concerns that men should be thinking about and they should be checking on?
Yeah, absolutely. So when you look at men's health particularly, 1 out of 5 men have one chronic medical condition that's known. And then if you look at the Rio Grande Valley particularly, that rate is even higher. And the 5 most common conditions that men do deal with in terms of affecting their health is 1 is hypertension, 2 is diabetes, 3 is heart disease, 4 is arthritis, and 5 is cancer. And it's very important that men try to at least get their regular preventative health exams done so these conditions can be treated and gone about accordingly.
Definitely, and you did mention hypertension and diabetes, which are conditions that are preventable. So would you be able to expand a little bit more on what lifestyle changes can they do to prevent these medical conditions?
Yeah, absolutely. So these medical conditions oftentimes, they don't really cause a patient to feel acutely ill at the time. However, if these conditions such as diabetes and hypertension linger for a long period of time, it's towards the end they become fatal when you get hospitalized, and they really become debilitating for the patient. So, for example, hypertension, the only way you know you have hypertension is if you go see a doctor and you get your blood pressure measured. The only way you know you have a high blood sugar or you have an A1C that's elevated is if you go see the doctor and you get blood drawn, and then you're known for having diabetes. And it's very important to note that in the Rio Grande Valley particularly, 1 out of 3 individuals here have diabetes. And diabetes, you don't really just know, it's a silent disease. The only way you really know that you have really high blood sugars is if you start having extreme thirst, you're urinating frequently, you get dizzy, and so forth. And at those times, a lot of times those patients go to the hospital. Or sometimes you get other chronic sequelae diseases such as heart disease that stems from underlying diabetes because it affects your vascular structures. And so it's very important to go see your primary care doctor. And a lot of times men particularly don't want to go see their doctor because they feel that like they're healthy. They feel like I'm walking, I'm talking, I'm able to go do work, I'm able to enjoy hanging out with my friends. There's nothing wrong with me. Why should I waste my time seeing a doctor? And that's not exactly the attitude to have, because a lot of these conditions are only diagnosed when you go see a doctor in the office.
Yes, definitely. And it's so important what you mentioned, because it's true also here with our employees. We do notice that men do have a tendency or less tendency to go to actually a primary care physician office, go have their wellness exams, which is really important as well. Doctor, you did mention about the A1C test and the hypertension screening, but what are some other health screenings that men should be doing, and maybe based on their age?
Yeah, absolutely. So it really depends on their age. For example, some of the big ones that I think are important, obviously hypertension at every visit. We check blood pressure at every visit. We try to see if you have high blood pressure. 1 out of 3 men do have hypertension, so it's very important that we go check people's blood pressure. Diabetes is particularly screened. The recommendation is age 40, but I think where we live and the demographic of the Rio Grande Valley, I think we probably screen for that a lot earlier. We check for hyperlipidemia or high cholesterol, which basically if it's really elevated, it causes plaques in our arteries, and that could lead to strokes or heart attacks. So it's very important that patients get their lipid panel looked at. But I think other very important things that oftentimes we don't talk about are colon cancer screenings. At age 45 now, which that guideline has been reduced 5 years, it's very important to check for colon cancer. And I think particularly in the Rio Grande Valley, because we have a primarily Hispanic population, and it's important to note that 1 out of 5 people in the Rio Grande Valley, in the Hispanic population, develop cancer at some point in their life. And that's a statistic that not many people do know about. And the only way you can prevent a fatal cancer, any cancer diagnosis is very, hard for an individual, but a lot of times you can do something about it if you diagnose it early. And that's why colon cancer screening is so important. Prostate cancer screening, which begins at age 55, is so important. If you are a smoker, I urge you to quit smoking, but you also should get a low-dose CT scan at age 55 to 65 to make sure that you don't have lung cancer. If you're a smoker and you have underlying hypertension and so forth, there's another scan that you can do to check for an abdominal aortic aneurysm as well. And so there's different types of screenings that are out there. If you're born between 1945 and 1965, it's important to get a hepatitis C screening, for example, that's done. And then after the age of 65, for example, there are preventative therapies that can be given, like pneumovax, Tdap, the annual influenza shot that's supposed to be given. Now that we live in the era of COVID, it's important to get your COVID vaccine that's out there. And so there's many different screenings that should be done. And particularly if you're younger, let's say you're 18 to 30 or so forth, it's actually recommended by the American Family Practice Association that every year everyone should get an HIV screening at least once a year, because HIV is a fatal diagnosis. And so that's very important to keep in mind as well. So, and then now, I think with the stressors that we've had with this pandemic and people's occupations, really consuming their time, and just the daily stressors that people deal with, stress, depression, and anxiety are on the rise, unfortunately. We all have smartphones. We all have access to the internet and computer. We're reading things. There are so many things that bring about depression and anxiety right now. And your primary care doctor is one resource that can really treat depression and anxiety. They typically do a yearly screening of a PHQ-9 or a GAD-7, which are screening questionnaires for depression and anxiety for patients. And that's a way for them to get screened and looked at for these conditions, which are medical conditions. They're not just a social stigma that's out there. They're real medical conditions that I urge for patients to get treated on.
Definitely, and as you mentioned, the pandemic has brought a lot of tension, stress, and definitely has been an increase in those conditions, anxiety and depression. So I know you mentioned about having their wellness exam done every year. Let's say that a patient is experiencing some types of symptoms regarding mental health, for example, they can definitely go back to their PCP and ask for a test?
Yeah, absolutely. So if any patient is experiencing depression or anxiety, I think one, it's important that they don't ignore it and don't just say, oh, I'll get over this on my own. I think particularly with men, they're not as likely to seek help or assistance for it. But I think it's very important for them to use the resources that are out there. Their primary care physician is a great resource for them to use, and you have that patient-physician confidential relationship that's there, that's important. But not only that, there's if you're having a real severe mental health outbreak, it's very important that there's resources like the SAMHSA, like the Substance Abuse and Mental Health Hotline that they could use. There's a national mental health crisis hotline that's out there. If you're a veteran, the veteran has a crisis line that's out there. But not only that, there's other conditions that predispose you also to getting depression and anxiety. If you're one that's an alcoholic and you're secretly drinking a lot, but you're trying to quit, there's Alcoholics Anonymous that's out there in the community. If you're, for some reason, unfortunately, with this opioid epidemic that we do have and we still are in, if you got addicted to opioids, there's Opioid Anonymous as well to get help on that. But also, your primary care physician is a resource for these conditions, and you should definitely try to seek out the help that is there.
Yes, definitely. And now that you mentioned alcohol use and drug use, definitely we do know that statistically men are more likely to engage in risky activities. So is there any recommendations to prevent any type of accidents and of course consequences of those activities?
So it's very difficult. I know men are particularly more prone to being involved in risky behavior, whether that's putting Christmas lights on their house and falling down, or whether it's engaging in a sporting activity like football or rugby or soccer and tearing an ACL and so forth. Those are conditions, obviously, sometimes are inevitable, but it's very important to have that established relationship with your primary care doctor, because then they understand your underlying conditions, which might affect the condition that's acute that you're dealing with at the time. But also, if you are a patient struggling, whether it's with opioids, whether it's with alcohol, whether it's with cigarettes, whether it's with other illicit drugs that are out there, it's very important that your primary care doctor could be a resource to kind of help you get off of, for example, opioids. There's other medications out there that they could substitute to slowly wean you off. Whether you're a cigarette smoker and you're trying to quit, there's resources that a primary care physician can offer, such as counseling, such as, if you need Nicoderm patches, Chantix, so forth. There's other things that they can do, but also your physician is one that can keep you accountable, and make sure that you're reaching your milestones in terms of headed in the right direction for you. So I think it's very important to maintain a good relationship with your primary care doctor, and really have an open dialogue with them about this.
I really like what you say about having an open dialogue and having a good communication, because definitely a PCP wants the best for the patient, right? And also trusting them, it's really important, and just not omitting any information, because we definitely need to make sure that they know the complete medical history. So
absolutely. And every visit, any physician, particularly, I work at South Texas Health System, but we review all your medications, we review any medical issues that you're complaining of at that time and that are chronic, any medication interactions that you're involved with, look at your family history. We ask all those questions, and so that's evidence-based care at its finest. So, yep.
Yes, and going back to the screening part that we had discussed before, what are some of the screenings that men should or will be recommended to do regarding sexually transmitting disease? Yeah,
so at age 18 particularly is when you should be starting screenings, but sometimes even younger if you've been engaged in sexual activity, depending on your sexual orientation as well. And so HIV is one big one that should be screened yearly. But I also think right now, with the advent of antibiotic resistance, gonorrhea and chlamydia are increasingly becoming resistant to antibiotics. Syphilis has unfortunately been on the rise during the pandemic because patients were unfortunately not able to go see their doctor to get treatment for these diseases that are sexually transmitted. So it's very important to get a screening, done, particularly if you're involved with multiple partners, or your sexual orientation is one or the other, putting yourself with risky behavior. That can really predispose you to having sexually transmitted diseases. So it's very important to get those screenings so you don't affect other people, and that's why it's so important. But not only that, an underlying sexually transmitted disease can be very debilitating for an individual, especially if it gets systemic. And so it's important to get treated for the condition at hand, because it can do really bad damage if not treated.
So when you say systemic consequences, would you expand a little bit more on that?
Yeah, absolutely. For example, like syphilis, for example, if syphilis goes untreated, there's primary syphilis, there's secondary syphilis, and there's tertiary syphilis, and that can affect all the way to your brain, to your genital area, to your blood having an infection that causes you to feel ill. HIV, for example, how is that a systemic illness? Well, if you don't ever get it diagnosed, your CD4 count, your CD8 count, all of those counts go low, and then you get more prone to opportunistic infections like fungal infections, other bacterial infections, and those can really make you sick, and unfortunately you can die. And syphilis and gonorrhea, that can cause blood in your urine. That infection could spread in your body, where it can affect your abdomen, it can affect your joints, and that bacteria can sit in your joint. And so it's very important to get treated on these very early on.
Definitely. So it may affect the immune system, which consequently can have those.
It can affect your entire body. It can, yeah.
Well, Dr. Ann, do you have any recommendations that a man can do? And of course, this can be applied to women as well, but that they can do on a daily basis so that we can prevent most of these conditions, like we had discussed, diabetes, hypertension, maybe even cancer, like you said?
Yeah, absolutely. I think the most important thing is don't think of coming to your doctor only when you're sick. I think it's very important that you have your annual wellness visit with your primary care physician. I think that's very important. And I think it's very important that you as a patient ask the doctor questions. Don't feel intimidated. Don't feel like you don't need to ask questions and you just depend on the doctor doing everything for you. I think it's very important to have dialogue with your physician. It's very important to take time, ask him all the hard questions. Because you spent time out of your day as a patient to come go see a doctor. You're taking time off of work. You're taking probably even a PTO day just to go see your physician. So ask all the questions, have them written down, be ready, have all your medications written down as well. The other couple of important things, I think it's very important for patients to get some daily exercise in because that can, keep your metabolic rate at a really good rate, that we can prevent obesity. And obesity, at the end of the day, preventing obesity really prevents a lot of chronic metabolic syndrome type diseases that are out there. So I think it's very important. I also think a healthy diet, is very important. The most important thing that I think that I've learned, from other people, especially in the nutrition space, is if you can eat just only a fist of food on your plate. If you're eating more than that, you're probably putting on too many calories. And then the most other important piece of advice I have is when you look at your plate, if there's plenty of color, that's a good thing. If your plate is just one color of food, that is not good, because color means more vegetables, more fruits, and so forth, and you're getting a full aspect of getting nutrition. And so I think those are kind of important things, but I also think it's very important to assess your mental health as well. And I think it's very important to know what are stressors in your life and how to cope with those stressors. Is work really stressful for you? Is there anything you can do to lessen the stress that you have at work? Are you taking your home stress to work? Are you taking your work stress back home? I think it's very important to understand your stressors of yourself as well, and that takes communication. And I think communication with your family, your workplace, I think it's very important. So those are kind of the pearls that I would have.
Definitely. And now that you mentioned about stress, do you have any recommendations so that they can manage stress, or that we can learn to manage these stressors? And of course, they are part of life, so we cannot avoid them, right?
Yeah, if I had the solution to that, I think I would have the answer to a lot of things in life. But I think a few things when it comes to stress in general. I think it's you know yourself and you know how to cope with it the best, and I think it's okay to ask for help when you need help. I think it's okay to ask for time off when you need time off. I think it's when you're sick, it's okay to take time off when you are sick. I think it's very important that people get the necessary time off to function well, whether it's at home, whether it's at work, and so forth. And also use your weekends very wisely. Do something different. Change the atmosphere a little bit if you can. I think is very important for individuals. But if you are struggling, there are many reasons that you're struggling. There's always a physician that's out there. There's always a counselor that's available for you. There's always psychologists, psychiatrists that are also available. So definitely seek the help when is necessary. And now with the advent of technology, there's many online spaces that you can seek therapy and counseling and so forth online, and you should utilize those resources when possible.
Yes, telehealth services, virtual counseling sessions. So yes, definitely. And going back to your first point on this question, where you discussed how important it was to talk to the doctor and ask questions, I think it is important to emphasize that it's okay to ask questions until you understand the situation, because I do know that sometimes we don't understand the medical terminology, right? And it's really important to get that clarified so that you can actually know what steps to do and how you can improve.
Absolutely, that's so important. And then it's also okay to have your family member, listen in on the conversation if they're not there. It's also okay to have your doctor write out your medications on how to take your medicines. A lot of times patients, they get medicines prescribed, but they're not taking them properly. So I think it's very important to ask your doctor to write down your medications on how to take them. Just ask questions. I think that's a very important thing, is ask questions to your doctor.
Yes, and going to the doctor actually.
Yep, that is true. That is true. Not just when you're sick.
Exactly. Doing the wellness exam, and then of course, hopefully they can get the screenings that we have discussed. Well, thank you so much for joining us, Dr. Gogu. It was a pleasure talking to you. Thank you so much for discussing these important topics regarding men's health. So thank you for being here.
Yep, thank you so much for having me.
Well, thank you everybody for watching. We definitely invite you to subscribe to our channel, Hidalgo County Wellness Program, and look for the next video of our Wellness Exchange series. Thank you and have a beautiful day and stay healthy. Thank you.